the PPE Portrait Project in Liberia for the Ebola crisis that inspired Lori, who saw Dr. Patty at St. Barnabas here on this show. And then she sent Dr. Patty his portrait, and that's why we were able to see him wear it. The same work also inspired a Stanford University researcher who works on quality improvement of patient care. As the COVID-19 epidemic drove tens of thousands of patients into American hospitals, and American frontline health providers everywhere were into full PPE whenever they could get their hands on it, the Stanford researcher, Katie Brown Johnson, got in touch with Mary Beth Heffernan, and now they are working together on a project at Stanford that provides PPE portraits to hospitals across the country. They have a DIY version of the project on the web, which is basically a template that health workers can use to do this. I will also tell you that we got kind of a hilarious offshoot of this idea from a brother and sister team named Linda and Jack. Jack was recently being treated for cancer at the hospital during the COVID-19 epidemic, and after seeing all the medical workers dressed head to toe in protective gear, Jack and his sister Linda and their other siblings decided to design their own sort of homegrown, home-conceived version of this very fancy, high-level art world, high-level medical world idea. And what Jack and Linda and their siblings came up with is a version of it that is sort of equal parts awesome and hilarious and slightly unsettling. Look, behold, it is the selfie mask. This isn't you printing a portrait of your straight-to-camera smiling face on a sticker that you put on your gown. This is you approximating the look of your face as kind of a mask overlay. It's like wearing a face suit of yourself on your face. They tell us they've now made a bunch of them at the hospital Jack is being treated at for cancer. This is Jack's oncologist wearing his. Look at that. He could shave that goatee. Nobody would ever know. Jack and Linda's brother Andy helped come up with a fairly simple way to augment a normal 2D image of a person's face so that it could wrap around a traditional mask, a traditional face covering, along with the link to the Stanford template for health workers to get those portraits for their PPE gowns. We'll post a link on maddowblog.com to the Selfie Mask web tool that lets you upload an image and print one for yourself, just in case you too want to stop walking the dog looking like this and instead want to start walking the dog wearing your own face on your face, right? I told you, it's like equal parts hilarious and awesome and unsettling. But it comes from this idea that is deeply rooted in patients needing that human connection with their providers. And it turns out to have pretty good data, a pretty good data basis in terms of understanding how this can help patients when they are otherwise at what may be the worst and most scared time in their lives.